Hi everyone, this is the third webinar in a series of webinars that we've done sharing the learning and practice from a set of regional events we delivered in 2018 to 19. The focus of the events was on joint working, so integration of agencies together to achieve the best outcomes for children and people with SEND. We have pulled together the effective practice that we heard from at each event and themed that, so you can get a bit of a flavour of what was talked about. We're also going to add each presentation, the detail that sits underneath, to the website, so you can find out more information about each individual example too.
So, and just to introduce us, I'm Sarah Hart and I work for the Council for Disabled Children and the Health team.
And Anna Gardner, and we're going to take it in turns to talk you through.
Yes. So, as Anna's just recapped, we held 9 events around the country, so one of these in each of the Department for Education regions. In each of these areas, we worked really closely with key partners from the NPCF, NHS England, Transforming Care, and the regional coordinators for each region to determine the agenda and to make sure that we have a really good range of stakeholders attending across education, health, social care, and from parent carer forums. At each of the events, we gave a presentation on the national picture, but we also invited speakers from the region to introduce 2 examples of best practice or new ways of working. So just to talk about ways in which they were doing joint working locally that they felt had worked for them or been effective. And we also spent some time at each event doing some discussion work and some action planning. So we're just going to start this webinar, as we've started many of the other events, by recapping why we need this focus on joint working. So there are a number of reasons now, and most people are really familiar with this, but firstly, it's about engaging with reality. So we know that children and young people with SEND, just like the rest of us, have complex lives and that their needs cross traditional service boundaries. So they're much more likely as well to belong to other groups that need support. And in a minute, I'll show you a diagram that just illustrates that with some data. We also know the policy context has been driving us towards joint working for a long time, particularly the Children and Families Act has placed duties on local agencies to work together around SEND. And the financial context, whilst it might appear to make things more difficult, actually can be a real driver for integration, because working together has the potential to reduce pressures not only on families but also potentially on services and professionals as well. So this is a diagram that we've shown at each of the events. I've tried to update the data now because it's been a while since we held the first one, but essentially it illustrates the overlap between the different groups of children and young people who require support from the professionals we work with. So you can see that 57.3% roughly of looked after children have a SEN identified by the end of Key Stage 2. Around 52% of young offenders asked for a 2014-15 study so that they were or had been in care at some time. 45% of young offenders sentenced in 2014 at the end of Key Stage 4 were recorded as having an SEN without a statement, and 28% as having a statement. And the list goes on. So we know that there is massive overlap between these groups. I should also say with this data, we don't have the national data to back this up in the way that we'd like to. A lot of it's taken from one-off reports. So we really would like to highlight here as well that there is a lack of data on this population, and it doesn't mean that we can't get a completely accurate picture, but we have enough to know that there's significant overlap, which just highlights the need for agencies to work together better. So that's just some context and sources. So if you're really keen on looking into the data on this, then you can follow up with this.
Okay, so now we're going to look specifically at those examples of practice. We'll, like I said, we've themed them by type of practice, so they're not themed geographically. We'll talk you through briefly what each area that presented talked about, and like I said, if you want to know more about the individual examples, we'll share all the slides. We have permission from each of the areas to do that, so you can find out more if you wish. So the first theme that we have here is meaningful co-production and participation. So that was a theme across a few of the regional events. Rotherham's Genuine Partnerships example was one that we looked at in the Yorkshire and Humber region. So Rotherham had a very well established charter, the Rotherham Charter, which is a set of principles and an approach to co-production that ensures that families, children, young people, parents are at the heart of the services that they access and the design of those services. And they've done a lot of work in taking that approach and helping other areas to take that on too. In the Northeast, well, the Northeast regional event, but linked to the Transforming Care work, which makes the geographical footprint a little bigger than just the Northeast. So Northeast and North Cumbria Transforming Care partnership footprint have for the last year been involved in an accelerator project. So they've had a bit of investment, they've taken a challenge that they were experiencing around Transforming Care cohort and ambitions as a programme, and they've used that investment to kind of really further that and find some solutions. But really at the heart of what they've done is genuine co-production from the beginning with parents. They've worked really closely with parent care forums. They've done lots of work in schools to develop their projects, and that's kind of central part. And then in the East of England event, we heard from Suffolk, we heard from a service, but also a young person who had experience of being strategically involved in shaping services. So Suffolk has a young persons network, which has been a really active partner in developing all their local SEND services. Spoke about his experience being involved strategically, and also about the skills that strategic experience and involvement gave him in finding his own employment.
So another theme that we picked out, and this again, it crosses across a lot of different examples here, but we've highlighted this example from Lincolnshire. So in the East Midlands, we heard from them on how they're building communities of specialist support. So they have a big piece of work in terms of collaborating across their Lincolnshire special schools. They had an issue where a lot of children were travelling a long way to go to the appropriate special school. So by sharing the different expertise the different schools had, they are hoping eventually that children and young people can attend the school that is closest to them, because all Lincolnshire special schools will become locality all needs special schools, and that's with the exception of SEMH, specialist provision only. In London, we heard a lot about promoting inclusion and effective SEN support. And again, this is a theme that came up not necessarily in presentations, but in discussion across a lot of the different workshops. So it's clearly a key issue. So we did hear from Simon Knight at Whole School Send an update on this programme, which has obviously expanded since we held that workshop, which was, I think, back in June of last year. Again, this does touch on some of what we just spoke about with sharing support and expertise, thinking about how you can strengthen links between mainstream and special schools to upskill staff, building the skills of teachers in the classroom to make sure that every child and young person is included in the most appropriate way. We also had a practical example from Enfield on their local processes and how they support really good quality SEND support in their schools. So we also heard a lot about integrating services, teams and processes. So an example from Northamptonshire from the East Midlands events, where we heard about their specialist SEND support service, which has been highlighted in a few different ways as being an area of good practice. They essentially integrated 3 teams to provide more comprehensive early intervention and support for children and young people with SEND. So those teams were the Portage team, the Early Years SEND team, and the Autism Outreach team and Early Help for Disabled Children's team, which have come together through that process. In the West Midlands, we heard from 2 areas that have done quite a lot of work to integrate social care more effectively within the education, health and care assessment and planning process. So in Telford and Wrekin, they've done a lot of work around this, and one of the key things we heard from them was the importance of having a SEND champion within social care, or a designated social care officer, or DISCO, and that's been coming up in conversations nationally as well. We also heard from Herefordshire, where they've introduced a new integrated pathway for children and young people with additional needs. So they've integrated their SEN and children with disabilities teams in order to do this, which hopefully makes the process much more streamlined for families.
So staying with the theme of integrating services, teams and processes, in the Northwest, we heard from St Helens local area, who have developed an integrated neurodevelopmental pathway, which was really well praised in their inspection, and since then we've actually gone back and done a bit more exploration of how they got to that pathway, and that's a separate resource that will be developed and shared imminently. But just to give you kind of the headlines from their work, so they have they looked at what wasn't working across their various pathways, thinking in relation to neurodevelopmental conditions. They had multiple pathways that often overlapped. Families were kind of pathway tired, I guess. So what they've done is really streamlined all those processes. They've developed something that's very much needs-led, it's not condition-specific, with a core kind of universal offer of support that wherever a family is on the pathway, whether they have been through the pathway and don't have any specific diagnosis or further intervention needed, there's still an offer of core support to them. So like I said, that resource is something that we've gone back because we're really excited by the work that they've done. So you'll be able to find out much more about that pathway and how they got to that and what it looked like by clicking on a link that we'll attach to the webinar. So you'll see more about that soon. In the Southwest, in Plymouth, they have developed an integrated approach across their community health and wellbeing and how that links to SEND. They have done a lot of work in Plymouth to develop a shared SEND strategy and a real integrated approach to identification of children and young people and supporting those children and young people with SEND. And that links very closely to their commissioning strategy, their joint mission work, and also the data and information which they have and capture routinely, which helps them understand need, helps them design services to be reactive to that need. And we've gone back to Plymouth to do a bit of work around data, and that's something else that will be available very soon for you to look at. We've a data dashboard that Plymouth and Torbay and Devon have helped us develop. So another theme was early intervention, that graduated approach. Broader than SEND, in West Berkshire they've developed an Emotional Health Academy, which is an early intervention model for supporting children and young people their emotional health needs in schools, a kind of single point of access approach, so that there is one door, if you like, to access support, whether that's web-based. They've got a web-based platform that children, young people can access and find more information around, or if young people need more specialist support, that's also the way they would access that. And they've really seen that increase, I suppose, engagement at a lower level if need, and hopefully prevent a higher level of input being needed later, but also a reduction in their CAMHS referrals as a result of that. Still in the southeast, West Sussex, we heard from the Therapies in Schools project, where therapists are employed full-time to work across multiple special schools and to really embed their therapy approaches and upskill staff in schools. They've developed a training programme. They're looking at how that might be a traded service as well, and plans to think about how they might then extend that into mainstream schools too. Back to Plymouth in the southwest, so they have been doing some multi-agency with families around their MAST project. So that's the Plymouth Learning Partnership have a long-standing MAST model around providing integrated support for children and young people with social, emotional, mental health needs. It's a service that's commissioned by schools and has a real graduated approach. Again, you can find out lots more about that looking through their slides. Okay, so another key theme that came out, again, not just in these examples, but
more widely in our conversations across the 9 events was the importance of having a shared outcomes framework and having a shared strategy that different agencies could come together around. And in the east of England, we heard from 2 local areas that are doing this. So Hertfordshire, following their sending section, I think in 2016, developed their outcome Bs framework. So 6 outcome Bs or high-level outcomes for children and young people that all agencies would work together towards. And that was for all children in Hertfordshire, so not just children and young people with SEND. So since then, Bedford has been taking the same approach. They've been developing their own framework, and they're also currently assessing how well they're doing against each of their outcomes by running a big piece of engagement work with families. So they're running a survey and some workshops as well to understand how they're doing against each of those high-level outcomes. And the framework was actually developed following engagement with parent carers, and it's based on the articles of the United Nations Convention on the Rights of the Child. Again, we will be uploading the slides, but there's also another webinar that we've produced where Bedford give that presentation again. So if you're really interested in hearing more, you can find that on our website. So another theme that came up was around supporting young people with learning disabilities and autism. So this linked back to the Transforming Care programme, which we know is coming to an end this year. But we did hear from representatives from Transforming Care across all of the 9 events, but there were a couple that gave more substantive presentations about projects in the region. So in Salford, we heard more about their programme to transform care for children and young people. So that's their accelerator programme, and it focuses on preventing the number of children and young people in 52 or 38-week residential school placements. We also heard in Yorkshire and Humber about a piece of work to understand better young people's journeys into hospital. Again, this came from the Transforming Care programme, but it was really interesting to hear about the programme finding that there is actually a group that's massively overrepresented, and maybe there's not the right support there for them. So that's the young people with autism only. So that came up as conversation, not just at this event, but at others as well. And the aims of this project were to understand what's going on with this group and how the system can better support them.
So staying with the same theme, in the Northeast, we heard from some work around the Promoting for Adulthood employment outcomes, and some work that has happened to develop a range of tools which support effective conversations around planning for employment. So the core to that approach was the recognition that there are lots of different pathways into employment, and some young people in Newcastle have been working with the community interest company called Spectrum Enterprises, which supports them to become self-employed and run their own businesses, those businesses being around home health services for older people. So a nice example of some of the different approaches to employment for young people as they move into adulthood.
And finally, we also heard in the Yorkshire and Humber region from York on a new centre of excellence, or that's what they were calling it at the time. I think the name might have been due to be reviewed, for disabled children and their families in York. So this was a project to develop a new range of support services which will hopefully enable disabled children to remain at home and get support they need in their community. So that included a new short break centre, and that was for young people with autism and learning disabilities and additional health needs. And then a family intervention rapid support team, or first team, in therapeutic short breaks. And this piece of work they were hoping to jointly commission between the local authority and the CCG by harnessing some Transforming Care funding. Again, you'll be able to look at the slides in more detail on this if you want to hear more. So we've talked a bit about all the positives that came out of these sessions. There were definitely some challenges that came up through our discussion with people in the regions across all of the events. So one of those, in terms of thinking ahead, thinking towards 1920, was linked with the youth justice system. So in a lot of areas, people were feeling that we hadn't quite got this right yet. There is some really good work going on to link up with the youth justice system, for example, around EHC assessment and planning processes. But the links aren't always there, and when you look at that Venn diagram we showed at the start and the significant overlap between these groups, it does seem like something that definitely should be a priority going forward. Another area of concern that came up was inclusion and exclusion. So we know there's been a lot of concern about school exclusions and possibly children and young people not receiving the support they need in schools to prevent their needs from escalating potentially. And we also heard a lot about identifying and supporting children and young people with autism only, which I mentioned before in relation to that presentation we heard in Yorkshire and the Humber. But again, this came up at a few different events, people feeling that this is a group of young people we haven't got it right for yet.
So we're now at the end of March, looking into the new financial year. So some things that are, from a national perspective, that are going to continue to be topics of interest, I guess, so that the SEND Leadership Board has now met once, and we're really keen to see what the outcomes of that board are and how that board and its work will support joint working at a local area level. We know that joint commissioning certainly is still a real challenge that areas who have been inspected come up against. So we wanted to find as many opportunities, I suppose, to help local areas to do that. One of those opportunities might be how the NHS long-term plan considers SEND and where SEND fits within all the kind of recommendations that plan makes. We know it talks a lot about an expanded key worker role, specific to those people with learning disabilities. Lots in there around expanded mental health services and support, which we know is a real kind of area of crossover with SEND. There are recommendations around information and training on learning disabilities and autism for the workforce, and lots of changes to the geographic kind of commissioning footprints, contracts changing, approaches to contracting, and then CCGs becoming larger. So we know that will have a real impact on a lot of the work that happens around SEND locally. There are also changes to the Ofsted framework, the exclusions review, which we expect to see soon. As Sarah said, inclusion or exclusion has been a real kind of challenge raised at a lot of the regional events, but I don't think we can be talking about exclusion without talking about inclusion too, so that there's something in there. SEND inspections continue to happen for areas that haven't yet had them. Those areas who have had an inspection but registered action will be revisited. We know that's happened in quite a few areas now, so still lots of learning and intelligence to get from those inspections. And coming in the autumn, an autism review, the strategy will now include children, which we welcome, and we hope that will help local areas to join the dots further. So at CDC, we will continue to be able to support local areas through the contract that we have had for the last couple of years. There are lots of resources that we've developed that are still available. We have our local area audit tools, one for CCG, one for local authority. We also have one that focuses particularly on participation, one around preparing for adulthood. We are in the process of establishing what our support looks like in 2019-20. We may look at regional events. There will absolutely be local support to local areas with and without written statements of action. We'll continue to host the DMO and DCO forum, as well as the Children Commissioners Forum, which functions as a kind of peer support tool, as well as a way that we can get a real sense of the good practice that's happening locally. That's our website there, which is where you'll find this webinar. You've already found it, you're listening to us. We also have a blog, Facebook and Twitter, so do get in touch. And if you're in an area that thinks you might like some support locally, again, do get in touch and we'll see what we can do. All right, thank you very much.